Dr. No from Revitalize Rehab Club. So today, I'll talk about how the small intestine, and what I do for the small intestine to enhance and get rid of your back pain, neck pain, whatever pain you have, if it is the small intestine stuff. So, backtrack a bit. So on top of being the 1% in the US, physical therapy in the US with the orthopedic and sports injury specialty, I realized there's more to it when I'm treating people. Things don't resolve. And so I came across something called visceral manipulation by Jean-Pierre Barral. Basically, he says that our organs have a natural rhythm. That natural rhythm is important for vitality, function. It keeps us going, thriving without symptoms and diseases. And so when that gets stuck, your body's going to protect itself using your muscle joint system to crowd around. You see that familiar pattern? Slouching, tight hips, okay, tight back, all that crowds around, protects it. So I get my hands in there, and each organ, so the small intestine is just a glob of just loops and that just here. It's the culprit in leaky gut for people autoimmune issue. So the small intestine is here. So the normal rhythm of the small intestine goes like this, where my fingers are at. Okay. So I get my hand in there, and you can actually feel that, believe it or not. So once I feel, you can detect where there's some stagnation, where parts of the small intestine is not moving well. So a direct technique, what I do is I get my hands in there. So I feel where the small intestine is not moving well, where it's attached, called the root, or then the mesentery is the small intestine itself. So I get my hands in there, and I try to free that up gently, very gently, okay? Your body doesn't like to be poked at, pushed at, right? And then so you gently just facilitate and just assist and reteach that movement of that part. So get my hands on the intestine, and then I guide it in the direction I want. So then now facilitate that movement pattern that the small intestine needs to stay healthy. That might be a reason of leaky gut, autoimmune, or back pain. Because behind your small intestine are your tight hip flexors, the one that's been known to really compress in your spine and disc, or your piriformis, your small intestine is right in front right around at the lower half. It can, if there's dysfunction there, this piriformis might act up and spasm to protect maybe this part of your colon or your small intestine. So that's how everything's all connected, everything works. So get your small intestine test out and assessed, treat it. You never know, it might help out. So Dr. No, signing out.